So this is from the NICE guidelines for depression in adults. It's actually from the old version of the guidelines, but the new version of the guidelines, it has the same sort of structure, but it's not as nicely set up as this. But the reason why I'm showing it is that in the UK, for example, when somebody comes to see the doctor, so say for example, Zaid was feeling stressed at work, he'd go to see his doctor, he'll say, I'm feeling a bit down, feeling a bit anxious, lots of things happening at work. The doctor will do an assessment, might give them some information about managing stress, and then would say, well, come back in a week and let's have a conversation, see how you're getting on. Okay. The idea is that as we go up these steps, the person gets more of a intense intervention. And the other thing is when a person's going through a mental health difficulty, the evidence would suggest that we shouldn't throw them medication straight away. We should give them access to a low intensity psychological intervention or a psychosocial intervention. So when Zaid then goes back to the doctor, feels I'm still stressed, then instead of giving that person medication, the doctor would then refer them to an exercise program, for example, might give them some more information. They might be given a low intensity psychological intervention, like behavior activation that we're going to talk about. And then if the person was obviously needed more help, they might then need medication or might need a more intense psychological intervention. And then there's some people who've got significant mental health problems, significant trauma in the past, and they might then need a multidisciplinary team to overlook their care. They might even need inpatient support at step 4. So depending on the severity of the patient's difficulty, they would get a more intense intervention. And one of the basic principles is that we offer psychological and psychosocial interventions first before we give medication. So for example, somebody's feeling isolated, it's obviously the case that person, he needs some support. So even on a hospital ward, so I work on a hospital ward for people with complex difficulties in terms of rehabilitation after a brain injury or stroke. And some people, because of an infection, they might be isolated in a room. So because of that, that might impact on their mood. So we need to think about how we can then support that person, give them more sessions, allow them visitors to come more often, despite them not being able to mix with people on the ward because of their vulnerabilities.